If I had gotten COVID in March and April when it first started, I would have been devastated because nobody knew what was going on. You had to go to this government hospital and God knows what the conditions were. So we were really, really scared at that time. The fact that it happened much later to us in September meant that a lot of things were in place. Nanohealth had put this thing in place, and Manish said, don't worry, somebody will come at home to take your samples. Okay, big relief. And then they told us about this package where somebody would call me every day to monitor what the situation was and then decide what needs to be done. That also changed everything because I felt comfortable in my own home knowing that Swati was there who would take care of me if anything went wrong. So again, human touch plus technology. Now let me tell you a little bit and then I'll stop and we can come back to it. Over the course, every day I will get a call from a nurse and I'll get a call from the doctor, a video call. So this is where technology comes in. You would think that that's not as good an experience as visiting a doctor. But for me, it was better because otherwise I would have had to arrange for a car, go to a hospital, worry about who I'm getting in touch with, wait for the doctors, and so on and so forth. And God knows in COVID situation, and in general, I worry about going to hospitals because hospitals are the place where you get sick, not where you get treated. You get treated too, but you're also worried about getting all kinds of sickness. The fact that I could talk to a doctor every day, and what they did was the doctors that worked with me told me that I could call them anytime during the day, made all the difference. Because of this, most of the time I stayed at home. And there was only one time when the doctor suggested that I go to Continental Hospital and get my chest scanned because he was a little worried. I had some high fever. He was a little worried that there might be some congestion in my chest. Even that experience, going to Continental, because I was going through this doctor, through Nanohealth, changed my experience completely. Everything was set up. I went there, they were all ready with the paperwork. Within 5 minutes, I was taken inside, the scan was done, and I left because I didn't have to worry about collecting the report. Those were automatically going to be sent to my doctors from Nanohealth. So again, it gave me an assurance. Talk about assurance. It gave me an assurance that everything will be taken care of. And I want to say one last thing, which is, especially in India, I have worried about the fact that if I go to the hospital, are the hospitals going to tell me things that are not true? I go with a cough, are they going to say, oh, get tested for this, get tested for this? And so there is this trust element. Here, I was going through Nanohealth. So the doctor who was diagnosing me was not the doctor who was giving me that test for chest X-ray. So the separation was important because I knew that the doctor who I was talking to for Nanohealth was looking out for my interests. So I'm going to stop here and say this conjunction of technology and human, both were very, very important. And what technology is allowing us to do through this telemedicine is, you see, the good thing about preventive health is, I remember when our kids were young, when your kids are small, you worry about every little thing. They sneeze and you say, oh my God, what's happened to them? Do a little, the spit comes out, so we call the doctor all the time. And most pediatricians will tell you that sleep over and call me in the morning because they knew 90% of the time nothing was wrong, everything will be okay. Same thing is true with this preventive telemedicine. If you can just talk to the doctor, they will tell you, don't need to go to the hospital. So 90% of your visits to the hospital can be avoided because 90% of the time, self-care with the help of other doctors is going to be sufficient. And that was indeed the case with me. And I am grateful for both technology in my life and the humans that I trust in my life.